Nigerian Medical Association, NMA, held their annual National Executive Council meeting from the 10th through the 17th of December 2023. The meeting, which was held at the West African College of Physiology Conference Center and Suites, with the theme, Achieving Universal Health Coverage in a Depressed Economy. While addressing the media during the association's press briefing to mark the end of the association's Executive Council meeting 2023 in Abuja.
The National Executive Council meeting of the Nigerian Medical Association was held at the West African College of Physicians Conference Center and Suites in Abuja, Nigeria, between 10th and 17th of December 2023. The theme of the conference was Achieving Universal Health Coverage in a Depressed Economy. The National Executive Council meeting was preceded by several humanitarian, social, and advocacy-oriented activities, including the 5th Dr. Ameyo Stella Adadavo Memorial Free Medical Outreach, powered by the Nigerian Medical Association, to Jahi community, which is a low-income residential area in Abuja. In all, 301 patients with various medical conditions were offered free medical consultations, surgical consultations, dental and ophthalmological services. There were media engagements on the theme of this conference. There were courtesy visits paid to the Honorable Minister of Health and Social Welfare, Professor Muhammad Alepate. We also visited CON. We also visited the Honorable Minister for Education, Prof. Tahir Maman, OON, SAN. We met the Honorable Minister of State for Education, Right Honorable Dr. Yusuf Tanko Sununu. We met the Permanent Secretary, Ministry of Defense, Dr. Ibrahim Abubakar Kana, MNI, and the Permanent Secretary, Ministry of Niger Delta, Dr. Shuaibu M.L. Belgore. The colorful opening ceremony under the distinguished chairmanship of the Permanent Secretary, Ministry of Defense, Dr. Ibrahim Abubakar Kana, MNI, had present the Coordinating Minister of Health and Social Welfare, ably represented by the Director of Hospital Services, Dr. Jimoh Salahuddin, MNI. Also present was the Minister of State for Education, Dr. Yusuf Tanko Sununu, ably represented by Right Honorable Samuel Adejare. The Federal Capital Territory Mandate Secretary for Health and Social Services was represented by Dr. Ahmed Danfulani, and His Royal Majesty Matthew Alaji Opaluwa Oguje Agba II, author of a gala, represented by Chief James Onoja, PhD, SAN, was the royal father of the day. The immediate past president of World Medical Association, Dr. Sahun Abulele, past presidents of NMA, past secretary generals of NMA, and the chairman of all NMA branches, including the chairman of the Federal Capital Territory, also attended the opening ceremony. Present also was the chief medical director of the Federal Medical Center, Jabi, Abuja, who delivered the keynote lecture, Professor Saad A. Ahmed, and other notable personalities within and outside the Federal Capital Territory. The NEC also featured a very successful NMA the second national retreat on developing effective followership skills, the panacea for actualizing our collective dreams. The NEC made certain resolutions which they have directed their leadership to inform the general public and the government. The NEC commiserates with the good people of Tudumbiri in Igabi local government area of Kaduna State. We commiserate with Kaduna State government and the federal government over the unfortunate accidental bombing of innocent citizens in Tudumbiri. We commend the military for accepting responsibility and offering apologies. We also call on the federal government to adequately compensate the victims and foot the bills of those in hospitals. We call on the military to improve the precision of their intelligence report to avert a recurrence. Secondly, NEC call on federal government to quickly stem the slide of the naira, which has consequent negative effect on the price of medications that has led to more suffering for our fellow citizens. This has made access to universal health coverage more imperative to reduce out-of-pocket expenditure for health care. We should tend towards universal health coverage now to help our people. NEC calls for caution in the political strife going on in Rivers State. And we call on the gladiators to consider the best interest of Rivers people in all their engagements. We noted the directive emanating from government for all cases of medical emergencies to be treated by doctors in private and public hospitals. But we have a few questions. Who pays for these emergencies? Where things are done properly, government should have universal health coverage whereby insurance can take care of it. Or we implement the National Health Act 2014, which was passed and signed since 2014, and it provided that 1% from first line charge should be set aside, partly to fund the basic health care, what is called the basic health care fund. That basic health care fund is supposed to take care of the first 48 to 72 hours emergencies for every Nigerian. It has not been implemented till today. So if you ask a private practitioner to treat people free, who pays? So these are issues that should be untangled before we start issuing directives, because every private hospital is a business, maybe running on loan. So let us stop paying lip service to emergency healthcare and do the right thing. On the directive by the Inspector General of Police for treatment of gunshot injury patients without police report for a certain period of time, we want to inform the Inspector General that the doctors are ready to comply, but we hope the policemen shall obey their IGP and stop the unnecessary harassments. Because you say that we have 2 hours within which to treat without reporting. If somebody goes in for a laparotomy